Hi, so today I will be doing a video about pilonidal disease. Pilonidal disease includes pilonidal abscess and a pilonidal sinus. Briefly, I'll try to describe what is a pilonidal sinus. So a sinus means a tunnel which happens into the skin. So this sinus happens near the tailbone of your body, or you can say that within the gluteal cleft or gluteal cleavage. So this problem is generally seen in young patients, men and women, below the age of 25 years. It is a very irritating problem to have for such young boys and girls, because it causes recurrent episodes of pain, and there is some pus discharge, foul smelling pus discharge that happens on a regular basis. So this is a very common problem that happens in this age group. Now, as compared to a pilonidal sinus, a pilonidal abscess is slightly different, that it has an abscess that is a collection of a pus. So both these together put together will result in a pilonidal disease. Often it is seen that a patient has, in the first instance, he develops a pilonidal abscess, that is, there is a collection of pus which then gets drained and it then gets converted into a sinus. Eventually, again, it may end up forming an abscess which gets drained again and forms a sinus. So this is a cycle where alternatively a sinus can form an abscess and an abscess can again form a sinus at the tailbone of your body into the gluteal cleft. Now, why does pilonidal sinus happen? It is very obvious that it doesn't happen with everybody. So there are some minute predisposing structural defects that lead to the development of pilonidal sinus. So I'll briefly explain how it happens. Once we have come to know how the pilonidal sinus happens, the next thing to understand is what are the treatment options of pilonidal sinus. Now, it is to be made very clear that complete treatment of pilonidal sinus is only possible with a surgery. It is not a disease that can be treated with medicines. Yes, you may be able to get over the infection by taking antibiotics and also control the pain by taking painkillers, but that's not the end treatment of the problem. You're just using this treatment to tide over the crisis, but the eventual treatment is always a surgical treatment for pilonidal sinus. So I'll briefly describe, there are the different types of surgical treatments that are available for pilonidal sinus. So this is the list. So the first treatment is excision. So this is a very traditional way of treating pilonidal sinus, where the sinus tract is completely excised under general anesthesia or spinal anesthesia, and the wound is kept open. Now there are no stitches applied. Now and you expect that the wound is going to close from within, and then the pilonidal sinus is supposed to heal. So this is an extremely old way of treating pilonidal sinus, and unfortunately this is not a very good way to treat pilonidal sinus, because when we are talking about surgical treatment for pilonidal sinus, it is very important to understand that pilonidal sinus has an extremely high recurrence rate. What I mean by that is, irrespective of which technique of surgery you use, there is a high possibility that the pilonidal sinus can still come back. So that is why we have got various different surgical techniques devised by various surgeons, and they practice the technique with which they have found good results. So excision is one of these techniques which has really bad results, and it has a very high recurrence rate, almost as high as 50%. The second surgery that was described in the list was excision and closure. So it is a slight variation from excision, is where you excise the sinus and you're just closing the skin. Again, this surgery has a drawback of a very high recurrence rate. So as per my opinion, simple excision and excision with closure are not supposed to be offered to all patients because of the high recurrence rate that we encounter with these surgeries. The third and very popular nowadays is laser treatment of pilonidal sinus. Now, it is popular because of the way it is being marketed, that it is painless surgery, scarless surgery, extremely patient friendly, and the recovery is just like that, and it's great, it's the best thing to happen for pilonidal sinus. So the marketing has been done in such a way that the patient gets convinced that this is the best treatment for his pilonidal sinus. Unfortunately, it is not. Unfortunately, laser treatment is not the best way to treat a pilonidal sinus. The reason again being that there are extremely high chances of recurrence with laser. That is a fact, and most of the surgeons avoid doing a laser treatment for pilonidal sinus because of the fact that the patient is going to come back with the same problem very soon. So as per my advice, I don't recommend laser treatment for pilonidal sinus. So finally we come to two most important surgical treatments for pilonidal sinus. One is called as the flap surgery and the second one is called as the BASCOM surgery. Now, flap surgery involves rotating an adjacent flap of skin and subcutaneous tissue, and then filling the gluteal cleft with this this flap. And flap surgery works very well. It is surgically challenging to do a flap surgery, but the results when done correctly are very good. So coming to the last surgery is the BASCOM surgery. Now I have kept this surgery as the last because this, as per my understanding, gives the best results in pilonidal sinus, and I personally do the BASCOM surgery for pilonidal sinus. It is based on a very sound principle as to why the pilonidal sinus happens in the first place. So as we discussed previously, it is a deep gluteal cleft that is responsible for the occurrence of pilonidal sinus. So in BASCOM surgery, it is designed in such a way that we are trying to obliterate the deep gluteal cleft and trying to make it more flat. So you are eliminating the reason for occurrence of pilonidal sinus, which none of the previous surgeries were actually addressing. To some extent, the flap surgery addresses this issue, but other than that, no other treatment really addresses the primary issue why the pilonidal sinus happens in the first place. So BASCOM addresses that, and it obliterates the deep gluteal cleft, and hence the recurrence rate with BASCOM are extremely less. In my practice, I have seen best results with BASCOM surgery. So I would practically advise BASCOM surgery to all those patients who come to me for BASCOM for pilonidal sinus treatment. I hope this video has been helpful to all those people who are suffering from pilonidal sinus, or to people who know that their relatives are suffering from pilonidal sinus. It is a very irritating problem. Many a times I see patients who have undergone one surgery, two surgeries and still have come back with pilonidal sinus, pilonidal ulcer, pilonidal abscess, and so this problem needs to be treated very carefully. we have to be very gentle while treating this problem, and if we do the right surgery, in my advice, BASCOM surgery, the recurrence rates are very less and it gives excellent results to the patients. So I hope this video has been helpful. Thank you.